Hello everyone, and welcome to the Blue Shield of California Understanding Individual and Family Plan training video. We put this training together for brokers who don't normally sell IFP, but might like some training on how to do so. Here are the topics we'll be going over in today's training. Here at Blue Shield, your health is our top priority. So we have a part of our website dedicated to the coronavirus resources for existing Blue Shield members. There you can obtain information on how Blue Shield Plans protects its clients from any costs incurred due to the novel coronavirus COVID-19 pandemic. Also, on this site you will see details about your coverage, getting care, and even prevention tips. For up-to-date information, visit blueshieldca.com/coronavirus or click on the Learn More link below. Understanding the new California individual mandate. This slide illustrates that California residents must have health insurance in 2020 or face penalty. A typical uninsured family of 4 would face a penalty of at least $2,000. But with the new financial help available, eligible households are getting an average of $504 per month, which lowers their premium substantially. So, beginning in 2020, California residents must either have qualified health insurance coverage, or pay a penalty when filing a state tax return, or get an exemption from that requirement to have coverage. Here is how the effective dates work in the open enrollment environment. Normally, open enrollment runs between November 1st and January 31st. Applications submitted between November 1st through December 15th will yield a January 1st effective date. Applications submitted between December 16th and January 31st will yield a February 1st effective date. Here's how the effective dates work in the special enrollment period environment. Due to the coronavirus pandemic, you can now enroll prospects for coverage both on and off exchange if they are uninsured and eligible. Additionally, you can also submit enrollments for prospects that weren't aware of the return of the state penalty or new financial help being available. Medi-Cal enrollment continues to be year-round. Here we have mapped out how the effective dates work during special enrollment, which is any submission received between the first and the last day of the month will receive an effective date of the first of the following month. Below that, you'll see our most popular qualified events, which are loss of coverage, moved into California, just married, and birth of a child. To see the full list of qualified events, just click on the box below titled See Full List of QEs. Here we have illustrated the difference between enrolling on and off exchange. On exchange means enrolling someone through the CoveredCA enrollment platform. Off exchange means enrolling someone directly through Blue Shield's enrollment platform. Some of the differences are premium assistance. This is only available on exchange. Follows the same effective date rules. This applies for both on and off exchange. Offers unique plans not found on both platforms. This is only available for off-exchange plans. Additional certification. This is for on-exchange. Length of enrollment time less than 5 minutes. This is only for off-exchange. And uses the same provider network. This is for both on and off-exchange plans. Here we have the steps to becoming a certified Covered California agent or agency. The first step for either path will be to create an account on Covered California. Once that's done, complete the online training through the Learning Management System. After that, pass the training certification exam, submit payment, and DocuSign forms. And last, finalize the account creation process. Shortly after that, your status should read certified. IFP and Medi-Cal income chart. Here is the income or FPL chart used by Covered California. We've added some enhancement tools to make it easier to understand. First, you'll notice the purple box at the bottom, Children Covered by Medi-Cal. So anything within that range means that children will be covered under the Medi-Cal program. Then you'll see in the first section, in the federal poverty level of 0 to 138%, which is illustrated by this dark gray section. Here we have a family of 4 making $35,000 or less, and this would mean that everyone in that household would qualify for Medi-Cal. Next, in the blue shadowed section, there are individuals between 150% and 250% that qualify for our CSR plans or cost share reduction plans. These are our Silver 73, 87, and 94, which are heavily subsidized plans. But notice within this range that the children will be on Medi-Cal. So for example, if you have a family of 4 within that range, let's say the parents might be on the Silver 94, and the kids would be on Medi-Cal. Here in the light gray section, we have individuals within 266% and 400% of the FPL. These individuals don't get the cost share reductions, but still qualify for federal tax credits in the form of premium assistance. Children of families up to 300% of the FPL still qualify for Medi-Cal. And last, we have individuals above 400% of the federal poverty level. They do not qualify for federal assistance, but they do qualify for the new California state subsidy, which provides premium assistance up to 600% of the federal poverty level. Covered California. What is considered income? Here, we've compiled a list of acceptable sources of income Covered California uses to calculate premium assistance and cost share reductions. Understanding health insurance metal levels. All Covered California policies fall into one of 4 levels of coverage: bronze, silver, gold, or platinum. This chart shows you the amount that each metal level covers and what the insured has to pay when utilizing their plan. Covered California Premium Assistance. Advanced Premium Tax Credit, or also known as subsidy, can lower the cost of health care for individuals and family members who enroll with Covered California and meet certain income requirements. For Covered California members who experience a change in income, they can either call Covered California or log into their Covered California account and update their income. This is something that's extremely important for your clients with subsidy to do whenever their income changes. Understanding dependent rules. When a dependent on a parent's plan turns 26, they need to quickly take action to get their own plan. Here are the guidelines. For on-exchange, your dependent can stay on your policy until the end of the year they turn 26. For off-exchange, your dependent must select a new individual policy by the end of the month they turn 26. And for embedded pediatric dental and vision coverage, when the child turns 19, that coverage terminates. So it's a perfect time to propose a dental and/or vision plan. Blue Shield Plans at a Glance. Here you see one of our most popular brochures. This brochure has a side-by-side comparison of all of our IFP PPO plans. This brochure comes in 3 versions: the IFP PPO version, the IFP HMO version, and the IFP Specialty, which shows our dental, vision, and life plans. These can all be found on the Broker Connection site. Blue Shield's top sellers. Here we have 2 of Blue Shield's best-selling plans, the Silver PPO 1950 and the Bronze 60 PPO. Both plans utilize our strong statewide PPO network. The Silver PPO 1950 is only available direct through Blue Shield and features a low premium, a very low deductible, and affordable unlimited office visits at a $45 copay. The Bronze 60 PPO is available both on and off exchange and features a low premium, offers 3 annual office visits at a $65 copay before any deductible costs, and this plan is very popular amongst younger and rather healthy individuals. Next, we'll go over the IFP hospital comparison between Blue Shield versus competitors in Region 16, which is Los Angeles West. As you can see, Los Angeles is split into two regions, 15 and 16. Los Angeles County, where 1 in 10 Americans live, and is the most populated county in the U.S. with over 10 million people as of 2018. The population is larger than 41 U.S. states and is home to more than 1/4 of California's population. Here you can see how Blue Shield compares to other California carriers. Some of the other things we wanted to point out for 2020, Blue Shield is still the only statewide PPO. We have had no grandfather plan closures this year, and we have continued to expand our Trio HMO network. And here is a list of all the hospitals in Region 16 and how we compare network-wise to the other carriers. Here is the IFP hospital comparison between Blue Shield and other competitors in Region 18, which is Orange County. Here's a list of all the hospitals in Region 19, which is San Diego, and you can see here how Blue Shield compares to the other carriers in that region. San Diego is the 5th most populated county in the state and the 8th most populated city in the United States. Small group versus IFP plan comparison. We have put together this chart to help members that are coming from a small group plan and looking to enroll in an IFP plan. You would simply find the small group plan they are leaving on the left and follow that line all the way to the right. It will provide the closest, most comparable plan with both on and off exchange options. To see the full range of IFP plans, click on the link on the screen or the Plans at a Glance brochure. When Medi-Cal is the best option for your clients. Medi-Cal is free or low-cost health coverage for California residents. Because of COVID-19, you may be able to get Medi-Cal after a job loss or reduction in earnings. 1 in 3 Californians is on Medi-Cal, making it the biggest health program in the state. Medi-Cal is an option for you if you don't have employer coverage and you meet the income, citizenship, and immigration eligibility guidelines. When to apply for Medi-Cal. Enrollment for Medi-Cal is open year-round. Once eligibility is determined, coverage begins immediately, going back to the first day of the month in which you submitted the application. Here are the different ways your clients can apply for Medi-Cal. Blue Shield IFP dental plans. Here you see our PPO dental plans side by side from our specialty Plans at a Glance brochure. We also have HMO dental plans starting as low as $10.70 per month. Our PPO dental plans start at $34.50 per month. And we recently added our new PPO dental plan with a $2,000 annual maximum benefit. Other good news, now when a member comes from another carrier with 12 months of uninterrupted coverage, we will waive the waiting period on our dental plans. And last, we want to highlight that our PPO dental plans also covers implants. Waiving waiting periods for IFP dental. 12 is the number of months a consumer must have of uninterrupted comprehensive dental coverage to qualify. 60 is the number of days you have to submit a request for waiving the waiting period. 30 is the number of days max that we have to make a decision on approval of your request. And below that are the different ways you can send Blue Shield the proof of prior credible coverage. Blue Shield IFP-Vision plans. At the bottom of the slide, you'll see the Specialty Plans at a Glance Vision portion where you can see all of our vision products available. And we wanted to call out our Ultimate Vision 15-25-120, which is our leading seller at the very affordable price of $6.50. This plan provides an eye exam at a $15 copay, new lenses with a $100 allowance, new frames with $120 allowance, or contact lenses with $120 allowance. For more info on these plans, click on the Plans at a Glance link at the bottom right. Blue Shield Broker Support. First, we have Producer Services and the Broker Sales Department. Together, they service 18,000 brokers for all lines of business. They utilize a phone queue system where phone calls are routed to individuals at multiple locations. Assistance can be requested via phone or email. Brokers can utilize our self-service tools as well. Tools like access to producer connection, the ability to start and complete an application with the client, the ability to send a personalized broker URL to a consumer, the ability to track enrollments using the redesigned app status tool, the ability to manage book of business using the existing online client list and the renewal list during open enrollment. And last, the ability to customize a website using the auto-generated broker URL. Broker support, selling training. For brokers who have access to the broker sales team, here's a list of some of the training that we provide. Open enrollment webinars, special enrollment webinars, broker roadshows, specialty sales training, broker resources training, training on producer connection, training on the online client list, marketing collateral training, and in-person training for our top brokers. We also do training with any random thing arises, for example, COVID-19 SEP training. Submitting enrollments direct to Blue Shield. Here we've put together a quick step-by-step guide to submitting an enrollment. Step 1, log into Broker Connection. Step 2, click on Start Enrollment. Step 3, click on Clients at the top left. Then you would create a client profile and then hit New Application. Step 4, fill out the application. So this was a very quick version of submitting an enrollment. For the full detailed training, click at the bottom left Visit Site button. There you can access the YouTube training and also view the PowerPoint presentation training. Broker resources. Our online broker resource landing page provides you important information regarding what to do if large or small group is dissolving and their employees are seeking individual healthcare options, how to navigate Covered California while selling IFP, IFP effective date rules during open enrollment and SEP, and how to submit enrollments for IFP from Covered California and off exchange.